So it's not really surprising that neck injuries are very, very common alongside a concussive head injury. Now, if you think about the physiology, it's not really surprising. I mean, they're really close to each other. It's almost like they're the same. So, a high quality systematic review and meta analysis have consistently shown that an associated neck injury alongside a concussion delays recovery by approximately 1 to 2 weeks. And also, some people they've shown that neck problems sometimes get like worse over time if someone is like not like being athletic. So this actually is so neck injuries are an effect modifier for recovery, but apart from that, they stronger neck muscles are actually associated with a lower risk of concussions. Okay? Now think about it like this. Because if the neck is like thicker, they're actually better at absorbing impact forces and thereby reducing head acceleration during like collisions, sorry, not clinicians. So research indicates that for every 1 pound increase in neck strength, there's a statistically significant reduction in the odds of getting a concussion. So this guy over here, okay, with his 18-inch neck circumference, this guy could probably tackle a brick wall with a minimal risk for a concussion. But research has also shown that a neck circumference of over 17 inches associated with a higher risk of sleep apnea. So you have to weigh the pros and the cons. Sure, I mean, it can decrease the risk of concussion, but then it's choking you in your sleep every night. So make educated decisions. So here's an interesting thing that I've actually observed and from one of my papers. So this is, I'll talk about that in a bit more. So neck injuries. So neck injuries without a concussion, they can actually mimic a brain injury. Okay. So think about it like this. If like there's like neck strain, people are moving, it actually causes referred headaches to the temples. And so people actually do complain of headaches when they have a neck injury. Similarly, neck strains. So if your neck is like slightly stiff or something like that, your balance, the three cranial nerves that are like telling your head where it is in relationship to your body, your sense of proprioception. Okay. If your neck is a bit stiff, this can lead to balance problems as well. So, like without a concussion, people are still showing, like balance problems. And also the funniest thing, so someone has actually written a paper about this. So they if you have a neck injury only, then technically, if you do a graded exertion test, and especially if there's motion of the neck, your symptoms can actually get worse on graded exertion testing. So you actually get marked with exercise intolerance. So neck injuries alone can mimic brain injuries a lot. So I wanted to do a study. So all of these patients, these 100 adolescents aged 12 to 19-year-olds, these 103 adolescents, what we did was they were all diagnosed with a concussion by Dr. John Letty, who's a very good experienced clinician. So I'm hoping that people agree that these patients would have been diagnosed with a concussion. And then when we sent them to a physical therapist, we wanted to see what the physical therapist wanted to do for treatment. Okay. Now, a very interesting finding is that in approximately 38 people or 37% of adolescents who were diagnosed with a concussion, okay, an ICD-10 code SO6, so like a concussion diagnosis code, they were only treated with cervical rehabilitation. Okay. Now, I made sure I read through all of their forms, subsequent files, because sometimes, physical therapists, if someone has balance issues and they have neck issues, then first they'd like to treat the neck issues before they start doing balance exercises. And I made sure that, like these patients were only treated with neck interventions and then they were covered. Okay, so even very good clinicians like Dr. John Lenny can accidentally, misdiagnose a concussion. So neck assessments from a physician point of view is pretty straightforward. We do our manual palpation exam, which I'll explain like the next slide, and then we do range of motion. Range of motion, super straightforward. Look left, look right, look up, look down, ears to the shoulders, to the other shoulders. Pretty straightforward. If you have one of those protractors, it's very nice that you can actually like measure their things. But we know that most of the times physicians are just saying, is this normal or abnormal? And not just physicians, many other clinicians, including our physical therapists, athletic trainers, and everyone.